Rheumatoid arthritis, or RA, affects 1.3 million Americans. Patients live with chronic pain, and exercise can help.
Exercise is a very important part to the treatment of rheumatoid arthritis. Exercise improves fatigue, it improves strength of muscle, and it improves function of joints. It can improve pain as well and is an important part of general health and general well-being.
So here are 5 guidelines to follow. Number 1, create an individualized plan.
Any exercise program that a patient with rheumatoid arthritis undergoes should really be individualized to that patient. Patients have different health problems, they have different locations where the arthritis has affected, and a physician can help individualize that program to further benefit the patient. Another important aspect of exercise that needs to be individualized is that patient's baseline. So a patient whose baseline is running a marathon is a very different person than a patient who's mostly sedentary in general at their time of diagnosis. But exercise can benefit all patients with rheumatoid arthritis.
Number 2, work with a physical therapist.
So patients with rheumatoid arthritis can have involvement of their hands or their knees or other joints of the body, and depending on which joints are involved, specific exercises may be beneficial. And a physical therapist who works with the larger joints of the body, or an occupational therapist who's specialized in hand therapy, can help provide an exercise program that can specifically strengthen problematic areas.
Number 3, find activities you enjoy.
There's a lot of different exercises that you can do, and if you're going to stick with it and continue this program, it should be something you enjoy doing. Different kinds of exercises include running, walking, biking. Some people enjoy yoga or Pilates, and there are many different activities you can do that are that will help improve your cardiac status and help get your joints strong.
Number 4, set attainable goals.
It's very discouraging if you don't hit your goals that you set, so a certain reality should take place when you're setting goals for yourself, and a physical therapist may be in a unique position to help you set those physical goals. What those goals are will really depend on who the patient is and will vary from patient to patient. So for a patient who really has been sedentary for years, who's just getting started on an exercise program, goals would be modest and include possibly at the beginning to exercise for 10 minutes a day and slowly increasing to 20 minutes a day, and then continuing on from there. For a patient whose baseline status was more active than that, it may be jogging at a slower pace would be an initial goal, and then a faster pace, and so on.
And finally, number 5, stick with it.
In terms of an exercise program, it's really important to stick with it because continued use of joints and continued exercise will continue to improve health and well-being, as well as fatigue and function.
With Everyday Health, I'm Taryn Brill.